everyone. Good morning. I am Linda Welter, co-owner and CEO of the Caliber Group, a longtime business member of the Tucson Metro Chamber, as well as a current board member. As an employer myself, I too have so many questions on how to best protect not only myself, but my team, my clients, my family, my friends during this pandemic. Not only today, but well into the future. This is not going away. This is something that we are learning to live with now and long into the future. So today we hope to answer your questions so you may have accurate information to make informed decisions for the health of yourself, your colleagues, your companies, your family, and your friends. Our speakers today are top-notch. They are experts in their own right. We have a blend of people that are here representing employers as well as medical professionals. And we have an attorney on our team here today who'll be here to educate you on the issues that most of us have never thought about that we would ever have to deal with in our lifetime. With us today, we have Dr. Sandra Leal, who serves as the Executive Vice President of It is my great pleasure to introduce today Dr. Sandra Leal, who serves as the Executive Vice President of SinfoniaRx and is President-elect of the American Pharmacists Association. She has served as past chair and current member of the National Center for Farm Worker Health and the Association for Clinicians for the Underserved. She has published and presented her work in numerous national and international publications and venues addressing issues related to underserved communities, access to care, public health, and immunizations. So with that, I'm going to turn it over to Dr. Leal.
Thank you, Linda. It's a pleasure to be here this morning to speak about this incredible pandemic that we're dealing with. What I wanted to do today is share a little bit about the vaccines, because there have been so many questions that we have been receiving. I'm a pharmacist by training, and I do a lot of work with the American Pharmacists Association nationally as we're trying to roll out and distribute the vaccine. So we have seen a lot of questions that people are posing around the safety of the vaccines, concerns that they have about the information that they're hearing. And so I wanted to share some slides to hopefully answer the questions and make you feel comfortable as you're receiving questions from your own employees. Here at Sinfonia, we have about 700, 800 employees across the United States, but a large concentration in Pima County. We're part of the chamber, and we definitely share this information to make them feel comfortable. In fact, this morning when I was walking to work, I passed the convention center and I saw a huge line of people trying to get their vaccine. So we know there's a lot of interest there, but the same kinds of questions come up every day. So I wanted to share my slides here. I don't have very many, but I definitely just wanted to share this information and hopefully address any concerns that you have as we go forward. So hopefully you can see those. Let me start with a little bit about COVID-19 and just the basic prevention. So even though we have a vaccine, we're still very much recommending to wear a mask and then follow the other recommendations that the CDC has been encouraging people to do. The distance is very important, washing your hands, all of the things that we know we should be doing, because even though we have a vaccine, we're still going to have to do some of these different measures. But there are 2 vaccines right now that have been approved by the FDA. These have received emergency use authorization, and it's the Pfizer vaccine and the Moderna vaccine. Both of them require 2 doses, and they have different spacing. So the Pfizer vaccine is 21 days apart. You receive the first dose, and then 21 days later, it is recommended to receive the second dose for the full effectiveness. Moderna is 28 days apart. And we have one more coming, hopefully in the next few weeks. This is an AstraZeneca product that's coming out. The reason there's been a little bit of challenge with distribution is because they require quite a bit of storage ability. So the Pfizer vaccine requires a deep freeze, which is requiring a lot more work to try to get it to the right facilities. Moderna is a little bit less difficult. It doesn't require that deep freeze. And then the AstraZeneca that's coming out will also have a lot more flexibility with the dosing. Let me go to the next slide here. So the safety question is something everybody's concerned about. How did this get out to the market so quickly? But really what I want to assure you is that all the phases are being followed. And in fact, because of the pandemic, so many people were getting infected that they actually were able to enroll people through these different phases much more quickly. So that was one of the reasons. Some of these phases have also interlapsed. So they've actually been occurring at the same time, which has helped with the process. And one thing I like to tell people is because the whole entire world has been focused on this, and because there is so much priority on this, this is one of the reasons why we have had so many scientists and so many people out there really trying to get this information about the effectiveness. I wanted to share my own personal experience also. I was part of one of the trials here in Tucson. We were lucky in Tucson to be one of the sites for the Moderna study. And so a lot of our local community actually had participants in the Moderna trial because we were one of the sites for that. But as you can see, for both of these vaccines, we had well over 45,000 enrolled in the Pfizer vaccine, and in the Moderna, we had over 30,000 participants in that. This is one of the most diverse enrollment to date for any study, which is incredible. And that has a lot to do with the locations that they selected, like Tucson. I actually received the placebo, which was the inactive vaccine. But on December 31st, I was unblinded and I was given the first dose of the vaccine. And then tomorrow, I will actually receive the second dose of the vaccine. So I can speak from experience and having taken it, and from other people in the community that participated. It was really good to see that we contributed to the science around the effectiveness of this vaccination. So the big concern people are asking is about mRNA. How is that safety around that? And really, when we're looking at the safety around that, that's one of the things that the FDA is collecting information about. But this is something that we're seeing a lot of reports on. I'll talk a little bit about that, but really there's a couple of different ways that we do vaccinations, the traditional vaccines and then the mRNA. This is not new science. There's been a lot of work with mRNA before, but it is something that we are studying and that we're seeing a lot of safety so far. And there have been in the United States about 4 million people vaccinated already. So it's really exciting to see that this is actually having the impact it's supposed to. So there are 2 shots that you have to receive for this vaccine. The first one is really to prime your body to make it comfortable with the vaccine, since this novel coronavirus is the first time that we've seen it. And then the second one boosts the immune system so that you have that best result. So it's really important to know that you might experience some side effects. You know, I don't want you to be surprised if you start seeing some side effects with it. But some of the common side effects include fever, headache, muscle aches, and chill, and typically they resolve fairly quickly. We've seen people that experience them for 24 hours, 48 hours, and then they start feeling better after that. There has been data collected, over 8 weeks of data, and there's more data being reported every day, especially as more people are being vaccinated. So it is important when you receive the vaccine to be monitored for 15 to 30 minutes, which is what is actually happening in the community. When we're seeing this being done at TMC and Banner and at the Convention Center and other sites, they administer the vaccine, and then there is an observation period just to make sure that you're doing well with the vaccine. These are a couple of things that are happening as a result of the vaccine. We are collecting data. There's this application that's loaded onto the cell phone called vSafe, and it actually provides texting messages, and it also provides the opportunity to report anything that you experience from the vaccine. So again, they're looking at this very closely to make sure that everything is really safe around this vaccination. None of the vaccines are live vaccines, so it's really only targeting a certain spike protein. So the mRNA vaccine provides the blueprints for that, and then the mRNA is gotten rid of by the body. So as soon as that's removed, your body then knows that spike protein, which is part of the coronavirus, is what it has to address if you do get exposed to the coronavirus. So the side effects that you receive from that are, again, very transient. Within 24 hours, you start to feel better. The second vaccine, some people are reporting a little bit more of that feeling. So that's one of the things to be concerned about. Let your employees know that the second dose might be the one that they experience that sensation. So you might want to consider staggering your employees when they're receiving that second dose, or even administering it on a Friday so that they have the weekend off, or following, the days off that they have. So a couple of things just to think about. I'm almost done with slides here. Just definitely, if you have any questions, it's really important to ask your providers. There's a lot of resources in the community. The CDC has a great website. But one of the things that people are asking a lot about is, if I've already had the COVID infection, do I get the vaccine? And the answer is, you do have a level of protection after having experienced COVID, but you also are going to be recommended to get the vaccination once there's enough vaccination out there, because you still want to have that protection. We don't know the exact duration of protection after you've had COVID, and then after you get the vaccine, there's different information coming out about how long that vaccine will be effective for. So we're hoping it's going to be effective for a while, but we're seeing different reports about it lasting for a year, 8 months. So we're still looking at that information. So just things to expect before your appointment. Right now, what you're doing about learning about the vaccine is really important. Make sure that you know if the vaccine is recommended for you. There's a lot of facts and information out there, but ask questions, especially if there's some things that don't seem to be right or that you're concerned about. The last thing we want you to be is afraid of the vaccine, because we know it's effective, and we're seeing a lot of countries, not just the United States, using it. So there's a lot of information coming at us from all directions. This is really important. I can't stress this enough, that even after you receive the vaccine, it's still important to continue to use the mask and avoid close contacts, and still follow the recommendations. And the reason for that is because a lot of people still aren't vaccinated. So not only, it's important to protect them, because you're protected with the vaccine doesn't mean that they are. And so you might still be a carrier for the COVID infection. So it's really important to continue to follow the precautions until a lot of people are vaccinated, and that way we can protect the entire community. So with that, I will stop my slides here, and then I will see if Linda, you have any questions from what I've shared. I'll stop.
Absolutely. Thank you for that overview. It's really, we're really fortunate as a community that we were able to have those trials here. You yourself participated in those trials. It's great to speak to someone who has gone through the first vaccination, and you're still alive and well, and still alive and well. So, one of the questions that I've seen on media recently is they're now starting to say that we should be double layering our masks. And do you have a comment on that? And in some cases, I even heard 3 layers of a mask to get that N95 effect. Do you have a comment on that?
Yep, I was reading that same information. I know Dr. Fauci was recommending to double mask, and I was looking at some of the statistics just this morning. They were saying that with 2 masks, you have a greater protection up to 70%, and then with 3 masks, 90 to 95% with covering that. And so it makes sense that the more filtration, the more cover you have, the more protection that you have. So if you can do that, that's great. I also always recommend to people, mask is just one thing, right? It's also the distance, because we know there's aerosolized COVID, so that makes a big difference, being in a well-ventilated area. And then try to keep to the essential functions, going to work if that's something that you have to do, trying to follow all those guidelines, and absolutely getting the vaccination when it becomes available to you. So it's not one thing by itself, but it's all of those things put together that really minimizes your risk. Now, it's not 100%, nothing is 100%, not even the vaccine. But I think when you put all of those things together, it really does improve your chances of actually minimizing risk. And then hopefully you're one of the individuals that is protected, or if you do end up with COVID, that you're still able to have a good resolution without any issues or complications.
So if I get the vaccine, can I still spread the virus?
That is the recommendation right now. If you have the vaccine, you can still be a carrier, and you could still potentially put people at risk. And so that's the information that we have at this moment. Things can change because things have been changing, but because there are still going to be people in the community that are not vaccinated and we do not have herd immunity, we are recommending even though you've had the vaccine, especially if you've only had the first vaccine, because you're still at risk. The vaccine is only about 50% effective after the first dose and not right away. You still get the first dose, and then you have to take about 2 to 3 weeks to build the antibodies. So you would still have to wear a mask after the first dose for 2 more weeks. And even after the second dose, you're still not fully vaccinated until you wait a couple more weeks. So all that time, and until more people in the community are vaccinated, it's still important to have all of the precautions to protect the community. You're protecting yourself, but then you're protecting all your neighbors by being able to avoid the potential of being a carrier for that. So that is still a risk, and I believe that's still going to be the recommendation. And just personally, I travel a lot. I'm now thinking in the future, I will probably wear a mask every time I travel now, because I know that there's other things, right? There's colds, there's flus, there's other things that could potentially be minimized if I protect myself, especially in areas that are very tight and where there are not enough circulation or ventilation opportunities. I'll probably wear a mask moving forward just for that protection.
I've come to the same conclusion. They're already reporting that cases of the flu virus are down significantly this year because of all those that are wearing masks. So after I'm vaccinated, will I need to get the vaccine annually?
So we're not 100% sure yet. Excuse me. What we're seeing is different reports coming out by the manufacturers where they're looking at how long the effectiveness of the vaccine is. And I just saw a report from Moderna that they're thinking it's going to last about a year. And again, we don't have that long of information yet because we haven't really had the vaccine for a year to see how long the immunity lasts. So that might change, but it's looking like it might require a booster or revaccination, especially as we're seeing different strains of the virus. We're hearing about the South African strain, the UK, all of these different variants. And like flu, we do have to get a flu shot every year because we have different flu strains out there. So it might be that we have to adjust the vaccine to be able to meet the needs of whatever that new virus or the changes are that are happening. So I anticipate that we might have to see that happen.
So, Dr. Leal, once you have COVID, do you have to wait to get the vaccine?
If you have COVID, they're recommending to wait until your COVID has resolved, and then you would be able to get the vaccine after that for more protection. Now, right now, they are saying that there is some level of protection after you have COVID. One of the questions we're seeing a lot of is, I received the first dose, and then I got sick because maybe they hadn't built the immunity yet, or they were already exposed and they didn't realize that. So they're asking people to wait until the COVID resolves before they get that second dose because they were in between doses. So they are still recommending after somebody gets COVID to get the vaccine because the vaccine might offer a longer level of protection than the actual infection itself. So again, all of this is sort of coming out. There's a lot of information. It keeps changing daily. But the recommendation in general is still to get vaccinated after you've had COVID because you can have more protection from that, or at least longer duration of protection with the vaccine itself.
So one of the things that has been stated is that one of the treatments for serious COVID patients is a transfusion of blood from someone who has already had the disease due to the antibodies that they would receive. Is this true? And if so, is this going to be utilized, a new practice into the future?
So there have been studies around this right now. So it's not conclusive yet. So there's not a yes or no clear black and white answer on this, but there are areas around the country where they've studied this, they have used this. Other countries have actually studied this also, and so we're still waiting to see. There not only this particular intervention, but there's other interventions that have been tried and that they're currently trying to investigate whether or not there's actual outcomes to support that. And we've heard them all on the news, but there's a lot of information, again, because this is such a new virus, there's still a lot of information that we're waiting on and trials to really see, and with definitive recommendations understand what actually works and what doesn't work. So I know Dr. Heinz will probably cover this because he's actually treating patients who have experienced COVID. So hopefully he can add more light to this topic.
So Dr. Leal, there's a lot of discussion out there about I've had COVID, now I have the antibiotics and I don't need a vaccine for at least 6 months because I'm covered. And then there are other people who say, well, I had a test afterwards and it showed I didn't have any antibiotics. Can you speak to the discussion around how long you can remain protected after you've had COVID, and whether or not that person should wait a certain period of time or not?
Yeah, I mean, this was one of the recommendations initially. If you've had COVID, you might be protected for up to 3 months if you had COVID. And so they were saying wait to get the vaccine, because the wait was recommended because we didn't have enough vaccine to offer. It wasn't so much because we don't think you should have the COVID vaccine, but it was more around the availability. So if you've had COVID and you have some protection, then the vaccine could go to somebody who has not had any protection. But as that goes away and we have more availability of the vaccine, it's really recommended that once your COVID resolves, to get vaccinated right away, because then you have longer protection. And we're still trying to figure out that level of protection. To your point about how long do antibodies last, it's variable. We've seen different reports. We've seen some people, they don't have any antibodies right away. Maybe they present later, they're lasting 3 months, or lasting, X number of months. It's so dynamic. All the information coming out is changing so quickly. But that is why I think they're just going to make that statement of, as soon as there's more vaccine available, definitely get vaccinated. And that way you're guaranteed a certain level of protection, versus trying to understand how long the immunity of the body is going to last. So that's the shifting information that we have. But I do recommend that if we have vaccine available, even though you've had COVID, get vaccinated, and then that way you're guaranteed that.
Okay, great, thank you. And then one final question. For those individuals not in high risk categories, why should they get a vaccine?
Definitely because it helps the community build herd immunity. I think that we make this recommendation for a lot of vaccines. Measles, for example, we had hotspots recently where people had decided not to get vaccinated, and we saw examples where people at Disneyland went and then exposed, a group of people. So it is a community service. It's a public health good for all of us to be vaccinated to protect each other. I think that's the recommendation, because we don't want inadvertently to expose somebody, a grandmother, a young child, because we're not getting vaccinated. And I think that is a true commitment to your neighbors and to business in general. When we have businesses struggling because of this pandemic, it really is an investment in each other to do that.
Great, thank you. I totally agree. Okay, thank you so much, Dr. Leal, for those great tips that we can put into practice right away, and educate our family and our neighbors and our colleagues, our team at our own companies. Thank you. So now I'm going to introduce our next guest speaker, Dr. Matt Heinz is joined us. He is recently been elected as our county supervisor. Thank you for serving. Dr. Heinz is a native of Michigan. He came to Tucson in 2003 for a residency in internal medicine at the University of Arizona and Tucson Medical Center, where he has worked since as an attending physician. At the hospital, Dr. Heinz treats patients with a range of diagnoses, from COVID-19 to heart attacks, head trauma, to chronic conditions like diabetes, PTSD, and even cancer. Dr. Heinz continues to work the night shift at TMC while serving also on our Pima County Board of Supervisors. Thank you. Prior to his current service, Dr. Heinz served as Director for Provider Outreach in the Office of the Secretary at the U.S. Department of Health and Human Services. At HHS, Dr. Heinz helped coordinate federal response to the Ebola virus and worked closely with healthcare providers nationwide implementing the Affordable Care Act. So he has some experience with pandemics. So Dr. Heinz represents District 2 on the Pima County Board of Supervisors. So with that, I'm going to turn it over to Dr. Heinz to share his perspective as an MD, but also in his role with Pima County. Dr. Heinz.
Well, thank you, Linda. Thank you so much for the opportunity to speak to some of your members. We've probably heard the word unprecedented a lot. This is certainly something that, healthcare workers like me, we've trained for, but I don't think expected something quite to this level. So it's been a bit of a shock to the system all around. And looking, and thank you, Dr. Leal, for your presentation, because I thought that was really, really a great overview in so many ways. In the hospitals and throughout our healthcare system, this is something that is going to be with us still for a little while, and that's I hate to be the bearer of not great news, but because we have the vaccine obviously available to certain categories of individuals based on their risks, their exposure potentially to the virus, but we are not really going to get to the level where you're going to see community spread substantially decrease for several more months. Maybe even toward the end of the year. It depends on how efficiently the counties and the states are able to get the vaccine distributed. So, which means we do have a few more months here in Pima County, unfortunately, of pushing our hospitals to capacity, pushing our ICUs to capacity, just to treat folks that are suffering from the disease. It is something that I know all healthcare workers, we are trained to run toward problems, and it's something that I do every night, and that so my ER colleagues do as well, and all of the nurses and respiratory therapists and amazing folks working literally every hour of every day and every night to keep people safe and alive. But because this is fairly highly transmissible, we don't have herd immunity, we don't have a vaccine that's been distributed thoroughly enough yet. It is still very risky out there. And that is something that people need to know. That's why you hear all of us, you heard Dr. Leal say this, you're gonna, I'm sure, hear some of our additional speakers say this. It's so important to keep up with the social distancing, mask wearing. They're just strewn around my place. I have them all over the place, right? Just because, not for entertainment purposes, but just because, I've obviously I use them in my shift. So, but very, very important. And I think it's important for people to know we're going to need to continue that going forward, as Dr. Leal said. And that is something that I think a lot of folks are like, hey, I'm going to get my vaccine and then we're good. We're back to totally normal. I think we're going to be able to get Pima County to a modified normal, but it's not going to be exactly the way things were before this all began. And so setting up those expectations is incredibly important. But I really appreciate the opportunity to be part of this forum, just because we need to get accurate information out there throughout the community, so people can really arm themselves with the science and the information that allows them to make the best decisions for their businesses, for their employees, for themselves, and again to encourage people to get the vaccine when it is their turn. Right now we are working on Category 1B. Nobody knows what that means. I mean, we probably do more now. But that basically folks that are 75 years and older, teachers, police officers, firefighters, those are the folks that we're working to get vaccinated right now. And of course, the Category 1A, that would be like healthcare workers, so folks who are on the front lines, who are right there, right exposed to the coronavirus pretty much constantly, like I am sometimes in my shifts. So and the reason for that, and I know there's some frustration in the community. I've heard it from some of my constituents and family and friends throughout the country. Why are we doing it like this? And that's just so we can get those who are most likely to be exposed to the virus, get those folks protected so they can help take care of people, obviously for the healthcare side of things. And those who are, say, in law enforcement, of course, our police officers, our sheriff's deputies, correctional officers, folks that are going to come into contact with people a lot just by nature of their job, their public service positions. We really need to get them the vaccinations as soon as possible. Something that kind of moving my hat a little bit to the county side of things, Pima County has now, at this point, stood up 5 different sites around the county, which when operating at full capacity, staffed, and most importantly, when fully supplied with vaccine, which we'll come back to, they will be able to deliver greater than 10,000 vaccines every day. But our maximum estimates could even push that up toward 14, 15,000 if everything is fully staffed. And again, we have the vaccine supply to do that from the state and the feds. At this point, we aren't there yet. And that's a frustration that I also share as a supervisor. We obviously want to be able to put as much vaccine into people's arms as possible. We just can't do that without the allocation, without the supply from Moderna or from Pfizer. We are head and shoulders above other counties in the state and across the nation because we have put additional funds. These are not funds that were necessarily made available to us from the federal government. The county just took the initiative to establish with partnerships with, for example, the University of Arizona, Banner Health, Tucson Medical Center, Pima College, helping us to provide some nurses and nursing students to help staff some of these sites, and the city of Tucson, because of the Tucson Convention Center location. Having these partnerships has really allowed for Pima County to stand up these 5 large pods that will help us to vaccinate, again, thousands of people a day. We're doing 5 up to 6,000 a day now, but that will be something that we'll be able to see increase as soon as we can get more. Now, I will say overall, there have been 79, as of Monday, 79,500 vaccinations that have actually been administered. Remember that the vaccines don't do anything, vaccinations do. So, and we're at about 7% of Pima County residents. Maricopa is around 5% right now. Coconino's in the lead. They're at about 8%, but that's only 12,000 people for them. So we have a pretty big task at hand, and the county has stepped up for infrastructure, and I'm really proud of that. Just we need to make sure people understand that some of the delays, not being able to get scheduled, either maybe it's not your turn in terms of the category yet, or more than likely for the next few weeks, it's just that scarcity of supply initially, that bottleneck that we're experiencing, that I'm hopeful that we'll see start to be relieved here in the next 2 to 3 weeks. And I think you have some questions, and I'm happy to answer those and any other questions you may have.
Yes, I do. Thank you for that. It was very helpful. I think I saw a report yesterday that Arizona as a state is, while we're not in the top 5 in the US in terms of our speed of distributing the vaccine to our residents, we're also not in the bottom 5. So I'm not sure exactly where we fall in between, but as it relates to Pima County, how would you compare Pima County to other counties throughout Arizona in terms of how we're distributing the vaccine to our residents?
Great. Yeah, that's a great question. We're seeing, as I said, we're up there. We're the second at this point in terms of, we might be the third actually, because I think Greenlee, very small county, has been able to get a lot of their residents covered pretty quickly. But looking at especially the larger counties, we're doing the best compared to, say, Pinal, compared to Maricopa County. Our rate of vaccination, so the per capita vaccine rate, the number of vaccines that we're delivering into people's arms per 100,000 is, depending on the day or the week that you do the analysis and look at the report, we're in the top 3 of all the counties statewide. So I'm proud of that, and especially again reinforcing that this is very much a supply issue, not a problem with standing up infrastructure to deliver the vaccinations. I worry that other counties nationally and even throughout Arizona could have some trouble once they have not unlimited, but plenty of vaccine supply. If you don't have the infrastructure built up, as you know, you're not going to be able to get these vaccinations into people in an orderly fashion. And especially for the Moderna and Pfizer, you have to have that coordination so that okay, it's now 21 days, it's time to get your second Pfizer shot. Okay, now for Moderna, this person got this on day, counting that as out is to get that as close as possible. It's not necessary that it's exact down to the hour, but obviously those are the recommendations from the manufacturers for good reason.
Mm-hmm. So, and on that note, we at the Chamber have received several concerns from members about the ability to sign up online for the vaccine. And for example, there are also many seniors who aren't computer savvy and
Sure.
They're having difficulty getting signed up for the vaccine. What do you recommend is the best method to get signed up to receive the vaccine? Is there a contact that they can call for assistance in getting signed up?
Absolutely, yeah. So a very convenient way to do it is to go to the Pima County website, and that's pretty simple. It's pima.gov/COVID-19 vaccine registration, all spelled out, just like I said. It's kind of long, but it makes sense, right? And that takes you to the main site at the county where you can make sure that you are qualified to start to sign up. And that's one of the reasons I know some people can get a little frustrated, because if they're, say, in the 65 to 74 age range, right now, because of that low supply, the scarcity issue for the vaccine supply, right now, Pima County is still prioritizing the 75-year-olds and up, and then teachers, firefighters, of course, healthcare workers, and police officers and other law enforcement, as we discussed. So, but being able to see, you can see that all there. And for those who are not tech savvy, are having some trouble signing up, going through that registration process using the online system, or who just don't happen to have maybe a family member, a younger family member with a smartphone, or who can help them, or who's around, we do offer, the county has a phone hotline, which has processing over 1,000 if 1,200 or more calls a day, and that is at 520-222-0119. And English and Spanish options, so people can use that as a resource to help get through that registration process, to make sure that's going well. And in some cases, in certain cases where folks truly just have very, very limited situations, that will be able to be something that the county can put those folks into a queue for potentially mobile vaccinations, which we're going to be setting up later this week and into next week. And also folks on those hotlines can also help to actually set an appointment directly.
So great information. If you could, for the benefit of our webinar participants, could you repeat again both the website URL as well as the phone number that you just gave us?
Certainly. So for the website, it's pima.gov/COVID-19 vaccine registration, all together, all spelled out. And then for the phone number, it's 520-222-0119. And I forgot the hours. It's 12 hours a day, and it is 7 days a week, and it is 8 a.m. to 8 p.m.
Okay, great. Thank you for that. Okay, so moving on to our next speaker, it's my great pleasure to introduce Julia Strange. Julia and I have had the pleasure of working together over the past couple of decades in various roles. And Julia is here today representing us as the Vice President of Community Benefit for TMC Healthcare. And I believe, Julia, you also have taken on another position. If you'd like to tell us a little bit about your new position.
Sure. Well, thank you for having me. I've been with TMC Healthcare since 1996. And more recently, a couple years ago, I took on the opportunity to be the CEO for Benson Hospital, which is in Cochise County. And so I've really seen on the front lines both the processes and the challenges and the opportunities in Pima County, but also from the view, from the desk and from the floor of a small critical access hospital in rural Arizona. And so it has really given a broad view of the challenges that we face. So I was asked to talk a little bit about community impact. And as I was thinking about this, and as we are in this 1 year that we've been into this pandemic, this vaccine is really the clearest path back to something that will look more like normal. We've felt this so much as individuals, as business leaders, and as a community as a whole. For individuals, it's about, it's about trying to be with family again, about kids being in school again, about jobs, and really back to more lifestyles, whether it's seeing our colleagues in our community and partners rather than through a screen, or going to a musical venue, or all of those things are things that we miss. As businesses, it's impacted our revenues, our viability, and our ability to maintain a sustainable workforce. It has changed how we work. It has changed our ability to do our work, and it has really transformed every aspect of our lives. TMC Healthcare is a healthcare provider. Tucson Medical Center is at the core of TMC Healthcare. We are a Tier 1A vaccination center, or Tier 1A population, and we were one of the initial vaccination centers in Pima County, vaccinating that group. We prioritize these vaccinations for our staff, focusing on the front line, and then moving more broadly. I will tell you that the day that we began vaccination was a profound and almost holy day at TMC Healthcare, as those frontline workers, the staff, the doctors, people like Dr. Heinz were able to get a vaccination. It made the light go on at the end of the tunnel. Currently, we've vaccinated about 70 to 75% of our staff. And since we've started that, and this is where it matters for businesses, our sick calls due to COVID have been cut significantly, way more than half. And so we are seeing that impact on our ability to keep our positions staffed and keep our staff at the front line where they're needed. Again, vaccination is really our path to opening up more broadly for businesses and returning to normal. It's a path to opening our schools and getting our children back into the classroom, restaurants opening, all of those things that make Tucson, Tucson. The school piece is really important. It's something that we at TMC have been focused on. And in fact, we partnered with a group called Higher Ground and opened up a learning center for our staff. We have 43 children in it who come in for distance learning education for 12 hours every day. And it's been a great success for us. I think as leaders, it's our obligation and our opportunity to educate ourselves so we can educate others on the safety and efficacy of the vaccine. And I appreciated Dr. Leal's presentation. I learned a lot from that, and I think it's something that we all need to really understand, so we can share that information, and it will help us get back to business as usual. TMC has been at the core of the vaccination effort in lockstep and hand in hand with the county and Banner and other providers. In fact, of the 80,000 vaccines that have been administered in Pima County, TMC has administered our pod has administered 38,000 of those. And this work is hard. This work is 24/7. And the effort that's gone into standing up this program to get vaccines in people's arms has not been without challenges. We are often unclear of how much vaccine, the supply of vaccine that will come. Dr. Heinz spoke to that at length. And so, it's really challenging if you don't understand the volume that you're going to be administering. It's difficult to plan. We have focused on those most at-risk population and currently really focusing on tier 1, tier B, and which includes that 75 population, the educators and protective services. The challenges are that, again, the supply and appointments outweigh is less than the demand. There are lots of challenges, as you discussed, with the people over 75, the challenges with technology and access, the challenge of just getting to the site. And so we're really working with community partners like Pima Council on Aging to really identify how we can get people with limited mobility and limited access to those vaccination centers. And if that's not possible, how do we get the vaccine to them? And then the other challenge was with the underserved and the minority communities in those populations, making sure that it's accessible, that there is an opportunity for all to, and there's an equitable process for us to make sure that all have access to that vaccine. It is complicated because, as Dr. Leal mentioned, the logistics of handling the vaccine are challenging, and it is it's not something that can really, it's something that requires a lot of understanding and effort to handle those logistics. We really ask people to be patient as we work through all of these issues as quickly as we can. Access is expanding. Earlier this week, the state announced that it has identified 60 retailers throughout the state to administer the vaccine. 6 of those are in Pima County, and they're all over the county. I believe, my understanding is that 2 of those are operational as we speak. One is in Oro Valley and one is in Green Valley. But most of those retailers, they're safe. They're grocery stores and drugstores. Those are really at the edges of the county to start, or at least the metropolitan Tucson, to start to expand that access point. They will be focusing as well on the 75+ population with educators and law enforcement. I was also asked to talk about the cost. The vaccine is free. We do apply a medical allowable amount that for the administration cost of the vaccine that is sent to an individual's insurance company. It is about $15 for the first vaccination and $28 for the second vaccination. At TMC, we are submitting those bills, those charges, and to the insurance companies. Should they come back unreimbursed, that is not something we would pursue with the individuals. Our goal, our intention is to make this absolutely at no cost for individuals. And that's all.
Well, thank you for that helpful information. I've heard some reports about the number of scams that are increasing out there with individuals who profess to have vaccines and they're charging for it, and they're also charging for other what they profess to be conditions related to treatments before or after you receive the vaccine. So what is your advice to employers and individuals out there if they run across an individual who professes to have the vaccine and they're charging for the vaccine? What is your advice?
It sounds too good to be true. It is. I really think that, staying focused on the county distribution process and the state opportunities is where those, the authentic, validated vaccination and supply is going to be. If people are asking you to pay for a spot, to get an appointment, that's a scam. If people are asking you to pay for the vaccine, that's a scam. So really go to the true north of the county website that Dr. Heinz mentioned, and or to the state website for that information, and really follow that.
There are some individuals who profess to have a health condition that causes fear from getting vaccinated, people who have pre-existing conditions. And can you speak to any situations whereby an individual would have a health concern and should not be treated with the vaccine?
And I'm not a medical professional, so I would, defer to Dr. Heinz.
We'll open the question to all the medical professionals here today.
I will say that there is a very small group that would have a reaction, an allergic reaction. We have not seen that in a significant, of all of the vaccinations we've done, we have not seen a significant population of that. So it's always important to speak with your primary care provider before you get a medical treatment, and make sure that you don't, have one of those symptoms. But for the vast majority of the population, it is safe and effective.
Thank you for that. So there's speculation out there that anywhere from, I've heard as little as 20% up to as high as 50% of individuals who will not seek to receive a vaccination. And if that is true, and that's what the future holds for us as a community, if a wide percentage like that is not vaccinated in our community, and I'm going to open this question up to everyone on our panel, what does that mean for our community going forward? How is that going to change everyday life for us?
Well, let me just say real quick, and then I'm going to turn it over to the medical experts. But the opportunity for us as leaders is to be part of the change, so that it is not at 50%, that we as a community get to 75, 80%. So I would really just passionately challenge everyone that's watching this, and everyone who has a business interest in this community, or who lives in this community, to take it upon yourself to be an advocate, an ambassador, and an educator about the vaccination process.
Absolutely. Thank you for that. So with that, I'm going to introduce our last speaker today, Tim Medcoff. We know that filling positions, working from home, and having an uncertain future has all played into creating difficult workforce dynamics, and has raised many questions and concerns for employers. Tim Medcoff, managing partner at Farhang and Medcoff, is here to try to create some certainty in these uncertain times by answering employer and employee questions. Rated an AV attorney, Mr. Medcoff defends clients in the areas of product liability, insurance claims, traditional labor, and all types of employment disputes, as well as commercial litigation. His portfolio is deep and varied, and his focus on maintaining client relationships serves to create long-lasting partnerships with clients. Tim has also been a presenter on prior webinars sponsored by the Chamber, giving great advice to employers on how to navigate COVID in the workplace. So Tim, can you give us your insights on, can an employer require the vaccine, number one? And well, I'll let you go ahead and start with that hotbed of a question. Can we require it? And then if we do, what are the consequences?
Sure. Thanks, Linda, for the introduction, the kind words. Thank you to the Chamber for inviting me to speak on this topic. I obviously don't have the medical expertise that that Julia and Dr. Leal and Dr. Heinz brought to the table, but I, like everybody else, have a workforce that I manage, and prior to COVID, it was very difficult to find good workers. Now it's the opposite because of the unemployment rates have gone up. So it's really important to really focus on taking care of your employees. And the vaccine and how we go about being advocates, as Julia Strange just mentioned, is really important to advocate to your team members the importance of getting a vaccine, and then wearing your masks, whether that's in 2 layers or 3 layers, and continue to spatially distance after getting your vaccine shot and your booster to minimize the spread of the virus. We as a law firm have been helping clients and non-clients alike to pivot because of the changing work environment. All of us back in mid-March last year had to move to business closures or working remotely. And a lot of us weren't prepared to do that. So our firm has created a COVID resource page at farhangmedcoff.com that provides a lot of free information to clients and non-clients alike. And one of those blogs that we have on there talks about this very question that you just posed, Linda, and that is whether you can require, as an employer, your workforce to get vaccinated. The general answer is yes, you can require your employees to get vaccinated. The better question is, should you? There's lots of questions that go into that, but generally speaking, you can require it if you don't have a written agreement with your employee that says that you can't make that a term and condition of employment, or if your employee doesn't have a legitimate disability that that would compromise their health system if they potentially got the vaccine and had a bad reaction to it. Again, as Julia Strange just mentioned, the number of cases that TMC has encountered has been very little. And I do want to commend TMC for their efforts to get the vaccine out. I know they and Pima County have been working really hard to get the vaccine because the demand is out there. I'm hearing this with all of my clients and their employees, as well as our workforce, about wanting to get vaccinated. So you're not going to get as much pushback, I don't think, as an employer on the vaccine as we initially thought when the vaccines were going through their trials. But if somebody has a legitimate disability, you need to engage in the interactive process and perhaps provide them a different accommodation, a reasonable accommodation other than getting the vaccine. In addition, if somebody has a legitimate religious reason not to get vaccinated, you need to engage in the interactive process to avoid a claim under Title VII. And then finally, if you've got a unionized workforce, there might be a collective bargaining agreement or labor agreement in play that you need to consult. And even if that agreement doesn't require you to bargain and negotiate with your labor union, you should probably do so as a good business partner with your labor union, because the last thing you want to do is be inundated with grievances, arbitrations, and unexpected legal bills. At the end of the day, right now, with the monetary crisis and recession that the pandemic has created, you as an employer don't want to be wasting money paying legal bills. And then the other things that I'm telling clients to do right now is take a look at your insurance policies to make sure you have employment practices liability insurance to cover potential claims if they're brought. Prior to COVID, employees, even if they felt like they were wrong, discriminated against, they oftentimes weren't bringing claims because they could find a job relatively quickly because the job unemployment rate was so low. Now with the unemployment rate much higher, employees are going to be more apt to potentially pursue claims. So you want to make sure that your business is protected by having adequate insurance, whether that's employment practices liability insurance or a rider for wage and hour claims, because those are typically the types of claims that are brought by employees who have felt wrong.
So as an employer, you have an employee who comes to you and says, I have a fear about a pre-existing condition and therefore I don't want to get vaccinated, or I need more information, or as an employer, I want a resource to send my employee to so they can alleviate their fears about getting vaccinated. Maybe this is a question for the entire panel. Advice on where to send your employees when they're pushing back out of fear about side effects, for example, on being vaccinated. Advice to employers out there in our region where they should send employees.
Sure. This comes up every day, frankly. It's been an issue, an ongoing issue from day one. And the fear started with fear of contracting coronavirus at work. So my answer to that question is this. Look, an employee cannot refuse to come to work if you're an essential employer and the work cannot be performed remotely. You can't, as an employee, not report to work because of fear alone. Now, if you've got a legitimate medical condition that if you contract the virus or you have a side effect from the vaccine that could have an impact on your health, then the employer must at that point, assuming there have more than 15 or more employees, engage in the interactive process under the Americans with Disability Act. But If they're just in fear and fear alone, that in and of itself is not a justification to avoid coming to work or to avoid taking the vaccine. And that this is incumbent on us all as business leaders to try to dissuade people from misinformation about the vaccine and the side effects. The studies and science that's out there to date has indicated that the side effects are fairly minor. That doesn't mean that they don't exist, but that you need to listen to the science and the medical providers. I tell people every day that they need to talk to their doctors about these issues, because you and I are not doctors. I may have stayed at a Holiday Inn Express last night and think that I'm a doctor, but I'm not a doctor. And I tell my clients and employers every day, you should not be making the call on these decisions. The healthcare providers should be making the call. And if they don't have a healthcare provider to contact, then they should get a hold of Arizona Department of Health or access or referral for a healthcare provider that can do a telemed evaluation to give them the information that they need as to whether their fear is substantiated and whether the employer must then engage in the interactive process. In addition, pima.gov/COVID-19 vaccine has some great information on the vaccine and the myths and facts as it relates to that. And that's another great resource to kind of get over this fear factor.
Great. That's very helpful. So as an employer, how do I handle a situation where an employee who has been exposed to COVID and/or a person with COVID and symptoms? How do I handle that situation when that comes to light at my place of employment?
Well, one, I would tell you, I'm sorry that you're in that situation, because it's a difficult situation, right? Because you're going to have anxiety with your employee, you're going to have anxiety with coworkers, assuming you're having people come to the office. But first and foremost, you need to train your employees in advance of that happening, that they shouldn't come to work, right? If they've been exposed to somebody who's COVID positive or they have COVID symptoms, the last thing they should do is report to work. The first thing they should do is call whoever the designated representative is at the company to report their potential exposure or their symptoms. The next thing that you need to do as an employer is obviously send your condolences to the person that, look, I'm sorry that you may have contracted the virus or have been exposed to the virus, but you need to call your doctor, your healthcare provider, to explain what's going on and get advice from your healthcare provider on what to do. And obviously you want to wish the employee well and to keep you informed of what's going on. And you also want to ask the employee, hey, look, can I use your name if for instance, the employee's working at the job site? You need to get their permission to use their name to engage in contact tracing. If they're not willing to give you allow their name to be released, then you can still and must still engage in contact tracing. You just can't use the person's name at that point, because we have a duty as employers to protect the personal health information of our employees. But you still need to engage in the contact tracing and then tell those employees who may have been exposed, call your doctor. I'm not a healthcare provider. I can't make a determination of whether you need to quarantine or if you need to go get tested for the vaccine. And the reason why this is all important is prior to December 31st, the Families First Coronavirus Response Act existed and provided paid emergency sick leave and or paid emergency family medical leave if the employee was sick or had been exposed or got quarantined under advice from a medical provider. Now, if you yourself as an employer quarantine somebody and you're not a doctor, then that's not going to entitle the employee to protection under what was the Family First Coronavirus Response Act. But Congress has extended the payroll tax benefits. So I've been encouraging a lot of employers, if you can afford it, you should provide those paid time off benefits as if the Family First Coronavirus Response Act still existed, because it's potentially a dollar for dollar payroll tax credit to you as an employer. So it's no skin off your back. It's not affecting your bottom line, but it's going to provide peace of mind to your employees that they're not having to worry about making the decision between their paycheck and their health, and also the health of their coworkers by coming to work sick. So you're getting that payroll tax credit, perhaps dollar for dollar, in most cases dollar for dollar. You're providing the message to your employees that I care about you and I want to keep you safe, and you're providing better safety for the greater community by encouraging people to stay home and talk to their doctors when they're potentially ill or exposed to somebody who's ill. So it's a win-win-win for our community, for our employers, for our workforce, if you continue to adopt this practice and procedure on how to handle people that are sick or been exposed. And I'm getting this question literally, Linda, every day, because employers are struggling on what to do. And the other thing to keep in mind with the new inauguration of our new president and the new administration coming in, President Biden's already been talking about a new COVID relief package that's going to extend the Family First Coronavirus Response Act perhaps till September of 2021. So it's just a good practice to continue to provide that benefit to your employees, because a payroll tax credit's still in effect till March 31st. So there's lots of reasons why this is in your best interest as an employer. And again, when we get to the backside of COVID, if you're taking care of your people, which in Southern Arizona, that's really important to do. I mean, at the end of the day, our employees are what make our work environment unique, fun, enjoyable. And it differentiates us and makes us better than our competitors if we have good, happy, productive employees. And if you're taking care of your people now, when we get to the other side of this crisis, when you go to put out a job listing, your employees are going to speak highly to their family, friends, and colleagues, and you're going to have a plethora of qualified candidates applying to come work for you because you're known as a employee-friendly work environment.
All really good points there, and a lot to take in as an employer, a lot to understand, make decisions, do the right thing. Also continue to run a healthy, productive, and successful business so that we can continue to not only keep our employees healthy, but run successful businesses so that we can keep their jobs in place long term. So I'm going to switch now to a question for the entire panel here today. And if you could, please tell us about what you are seeing within your own workplace in terms of COVID's current implications on your workforce and any aspect of your business right now. What are you seeing right now? And then look to the future. What do you feel are the long-term implications of COVID in your workplace? So I'm going to start with Julia. If you could tell us about current implications of COVID at TMC and then long-term implications.
Well, we, at TMC, at Tucson Medical Center, and in healthcare, we have been running fast for over a year now to understand and care for the patients. It has been emotional. It has been hard. We have struggled with having enough staff. We have struggled with through the surge and seeing individual after individual passing away, not having visitors, and this has taken a huge toll on our staff. We have done everything we could possibly think of to support our staff, from opening we called it the care shop early in the pandemic that had toilet paper and things like that, so that our staff could have access to those things that that weren't on the store shelves. We opened a school. We do specialty coffee carts that we bring around the hospital. So we've done everything we can, but it is going to be a long term while we recover, as our staff recovers personally from the strain and the stress and the trauma that this has put on them. I think long term, as a community and a state, we're going to have, and as a country, I believe we'll see some challenges in terms of workforce shortages, in terms of individuals who choose to leave the healthcare industry because this has been such a challenge. The good news is that the numbers of COVID positive patients in our hospital is going down, and that's occurring across the state. The vaccine is here. We have early therapeutics such as the monoclonal antibody treatment that we didn't have before. So the light at the end of the tunnel is getting brighter, but it's still a bit out of reach.
Okay, Dr. Leal.
So we are seeing a lot of our employees just feeling stressed because they have so many other things going on at home. The schools have been very challenging for a lot of our workforce, trying to manage their children that can go to school or have the hybrid schedules, or all of a sudden get a notification that they have to have their child be home because of quarantining issues, things like that. So we've been very flexible in accommodating those stressors that they have at home because we want to support them. And then a lot of our staff are clinicians themselves. We do a lot of telehealth, so we were able to have a lot of people work from home, and we support patients and answer questions remotely. We've been doing that since 2006. So we really seen the value of being able to do the telehealth model, and we just anticipate that's going to be something that will continue to be more adopted and more of a new strategy that's more commonly used, because historically a lot of people had not used telehealth before until this experience. So that's really important. I agree with everything Tim said about being able to be flexible, be supportive of employees, try to provide resources for them, because at the end of the day, we really value the people that we have, and we want to make sure we retain them. And we want to make sure that they felt supported during this. That's one of the biggest things that I feel very grateful for, that we've been able to make sure everybody had a job during a very difficult time. And hopefully that will speak volumes to our commitment to them and to their engagement and reducing their stress moving forward. But I think the biggest challenges that we've seen have been around childcare issues, around flexibilities. That's been one of the things that's been the most difficult to manage. And luckily for us, we've been able to do that.
It's interesting you mentioned the telemedicine. I recall attending presentations, and this was the wave of the future, telemedicine, and new startups getting involved with that. And then COVID hit, and all of a sudden it just fast tracked a practice that was needed. It made sense. It was the right thing to do, and it really just escalated it. So it's so wonderful to see your organization embracing it and being integral to providing sound counsel to patients that need help. So and I mirror many of the experiences that you are experiencing as well with our employees too. We're fortunate that we can work remotely, but it has its challenges. Employees homeschooling and trying to manage their work at the same time, I know has created a lot of extra stresses. Work days that, even though might be similar in hours to before, they just feel longer because you're homeschooling throughout the day, as one example. So I know that that's a challenge for our employees, and doing whatever you can to help ease their burden and reduce the stress and is very helpful as from an employer standpoint. So Tim, tell us about your firm. What have you been experiencing? You're giving advice to your clients, but you're also an employer who's dealing with many of the same challenges. What are you experiencing?
So at the beginning of this crisis, we had the same challenges a lot of different employers had, and that is this a hoax? Is this really real? The masks don't help, and obviously we got conflicting information both from the prior administration as well as from the CDC on some of these issues, which made it even harder to convince employees of the merit of engaging in social distancing and wearing a mask. For us as an employer, we, like you, were able to pivot to remote working. Prior to this crisis, we had at our own firm and with clients that were able to do this, we had told them, look, you know, people like to be flexible and have more flexibility. So to the extent that you can push emails to smartphones and issue laptops for people to work from home, you know, we encourage you to do that. But keep in mind, if they're non-exempt employees, you need to have a good work policy in terms of tracking your time to avoid having to pay overtime pay, for instance, for those non-exempt employees. As the pandemic kind of developed and the science and information became more consistent, wearing a mask and engaging in social distancing became a lot easier. Talking with employers about the need to purchase plexiglass and rearrange offices to encourage social distancing became more prevalent and agreeable, although difficult in many cases. And obviously, as the vaccine and the news of the trials and the success of the trials, that created more upbeat workforce, because most of us are social people. We like working with other people. We like engagement. And getting back to a work environment where everybody's back at work is going to meet those needs that we as human beings have. But honestly, one of the things, the other question you asked, Linda, is what's the long-term implications? I think that there's two things. One, for those of us that have kids at home, and I'm included in that category, you know, I wasn't expecting to have to be a teacher in my job description for 2020, but obviously I had to in certain cases. And then the stresses of dealing with teenagers at home that aren't able to hang out with their friends or do things that they normally do, or miss a graduation, you know, which my daughter had happen to her last year. All of those things, one, sucked for her, but created stressors in the family. So I personally think that employment assistance programs and counseling, if you're looking to graduate from college this year, I think that would be a great profession to look at right now, because I know that I have lots of clients, lots of people on my team that are, there's lots of stressors in their personal lives that they didn't have before, that they're turning to counselors and therapists. So if you're an employer, haven't talked to your insurance agent about getting an employment assistance program added to your benefits package, it's pennies on the dollar, and it's going to be a nice resource that you can push out as a message to your team that, look, I understand all of us have stressors in our life. We are not involved with this at all. This is a free benefit that you get from our health insurance package that we offer you. You don't talk to us about it. You just call the EAP and get a list of counselors that are included for free in most cases for you to go see for 2 or 3 or 6 sessions. And then after that, you might have to pay. But at least gives an avenue, again, being a compassionate employer, because I do see that as a long-term impact that we're all going to experience until we get back to some state of normalcy.
Great. Thank you. Great advice, Tim. Pennies on the dollar. Do what we can to help our employees. As you said, the stressors are not only through remote working, the new challenges being on the front line, for example, our healthcare workers, but also other stressors that are happening in people's lives. The isolation, for example, are impacting how we work, and anything that we can do to support our employees to be successful as employers, we should be doing that. So with that, thank you to all of our panelists for your time, your expertise, and the great tips that you are providing to our local employers. We really appreciate it, and look forward to staying in touch with all of you and having positive news to report as we march on through this pandemic.
It's been a pleasure to participate. Thank you for the opportunity.
Thank you, everybody.
Okay, take care.
Take care. Bye-bye.